Hey, everyone. It's Wednesday, and I certainly hope that you're having such a great day. And I hope that thus far it's been really, Monday, Tuesday, and Wednesday, because I'm doing this today on a Wednesday, and I'm not sure what day you're watching this, but I'm just really hopeful that whatever day you're watching this on, you've had a great day or you plan on having a great day. This is Sandra L., author of the Personal Health Journal and Planner, a board certified patient advocate, also the manager, I should say, a managing partner of MediHealth LLC and the founder of the Chom's MediHealth Foundation. And today's message, I come every Wednesday, I have an educational tip. Why? Because patients who are engaged become, let me start that again. Patients that are educated become engaged, and that engagement leads to empowerment. And one thing that we all need, society needs, is empowered patients. So I come each week, I try to give you an educational tip, something that you don't know about that you should know about. So today's tip is we're going to talk about the Merriam Webster's word of a year. And you know what? And it's ironic that this word of the year has been around. It's been in existence for such a long time. I'm not sure who on their executive team decided that, hey, we want to make this the word of the year this year, but I commend them for thinking, yeah, now's the time. It's been the time, but now's the time. So let me get right to it because I know, if you're watching live, that you have something that you need to be doing. And I certainly appreciate you joining me today, but I want you to be able to do whatever it is that you have to do. So, what is medical gaslighting? How many times have you gone or have you seen um, someone at the doctor's office or at a hospital or physical therapy, whatever, right? And you hear the doctor or the nurse or someone on the staff go, "Yeah, you know what? Are you sure? Like, what are you saying? You know, is it that bad? It's really not that bad. Is it the pain? You could be in excruciating pain." And they're like, "The pain isn't that bad, is it?" And you're like, "Yes, it is." And you're trying your hardest because you're in so much pain to understand why it is they're asking you that repeatedly. Or you go to the doctor's office and you're like, I ain't waiting on them. If they lose some weight, and you're like, what? And again, they tell you when you're sick, hey, that weight loss that you have, if you lose it, you be okay, right? Or you know what? Yeah, it's not all of that. It's not really that bad. It's really not that bad. Like, think about it. Like, is it really that bad? What's occurring to you is that you're being gaslighted, or what you see occurring to that other patient is they're being gaslighted, whether it be because of your race, whether it be because of your size, whether it be because of some cultural difference. If you go into a provider's office or you go to a medical facility and you're hearing constantly those words, "Oh, it's not that bad. Oh, you could get, lose some weight. If you lose some weight, you'll be okay. Oh, I don't really believe in, I'm not one that goes with, same sex, or, and it's so derogatory, right? Especially if it happens over and over and over again. And I'm not telling you to let it happen, 20 times before you say something, or let it happen 10 times or 5 times. I say two, right? Because maybe the first time they didn't realize what they were doing. The second time they didn't realize what they were doing. But that third time, stop them. Stop them, because they have no right to treat you like that. They have no right to gaslight you. And guess what? If you don't say something, if you don't bring it up, it's gonna happen. And it's not only gonna happen to you, but because their derogatory demeanor on how they're treating you, the patient who is there to seek care, because yes, the pain is that bad. Yes, you need help. No, you don't need to lose weight. How do you know I even got this big? What business is it of yours? What type of lifestyle I live once I live here, once I leave here? Yeah, stop. Like, really, stop. Stop letting the medical system take control and take power over you. Become an empowered patient. Now, what I'm going to suggest that you do is a couple of things, right? Because you need to do a couple of things. Because if you say, hey, it happened to me once, the chances are no one's going to pay, no one of any authority that can help you, and not only help you, but help all of the patients that come behind you or with you. The one thing that's going to help your case in being reported is this: you keep track of it happened on Monday, February 1st. Then I had another appointment in March and it happened again. And I don't want it to happen anymore. So you're going to take down the information that's needed that can prove, that can prove your point. You want where you were, you want who it was that said it, and you can simply ask them. They don't need to know what you're doing. You can simply ask them, hey, what's your name? Like, play it off if you have to. Or if you really don't want to play it off, don't play it off. I'm one of those people that, you know what? I'm going to play your game for a minute and then I'm going to stop playing it. And when I stop playing it, that's when I'm going to get serious. And when I say a minute, I'm not talking about I'm going to come back the next time. Yeah, I'm talking about that day. I'm gonna let you say something derogatory or demeaning to me once. It's not gonna happen again. Not without me raising a point of this is how I was treated. So can you imagine how others are being treated? Right? Make sure you have once again the name. So you're gonna capture the name of that person. Two, you're going to ask them what department they work in because they might be 50 Susie Smiths working in, normally a doctor's office is not going to have that many people, but in a hospital, Susie Smith, there might be 50 of them, right? You want to make sure you have Susie Smith that works in whatever department she's working in. And you'll know the department because it'll happen to you while you're in radiology or while you're in lab or while you're in the emergency room department or while you're sitting in that doctor's office. So you'll get the name, you'll get the dates that it occurred on, you'll get what was said. If you can catch it verbatim, that's fine. You might even want to say, could you say that again? Just to see, right? If they caught themselves saying it or doing whatever it is that they're doing. But gaslighting, and then you'll report it. After you take it maybe like 2 or 3 times down the information, it's the same person. This is what was said. You feel as though you're being gaslighted. You want to know why. If it's a doctor's office that this occurred in, you can report it to the nurse manager and say, I was in the doctor's office and this person, whoever the person is, once again, you'll have it written down. So you'll be able to say, Susie Smith, and this is what occurred, right? So you'll be able to give that information, the exact information of what happened. Report it to the nurse manager. Now, you report it to the nurse manager and you go back for another visit and the same thing has happened. Chances are either the nurse manager forgot that you brought this up, right? So a lot of times you can follow up what you're telling the nurse manager with an email, but you may have, or he may have forgotten what you said, okay, well, maybe that was just a bad day and I don't want to get the employee in trouble, whatever, and didn't report it. But you do the next step. You bring it to the doctor's attention and say, I'm not sure if you realize this or not, but your staff is gaslighting people. If it's the doctor that's gaslighting you, you can always report that to the medical bureau, to the medical board. A complaint could be placed with the medical board stating that you went in and this is what happened, and you just want it notated and documented so that it doesn't happen again. If you're at a hospital, and at that hospital, in that facility, whether you're there as an outpatient, and it doesn't, a lot of times it doesn't even have to be you, it could be your loved one reporting this is what happened. Have them write it down the same way that you would write it down. So you'll write it down. You'll then call, because you can call the CEO of the hospital and make that complaint. Once again, put it in writing, because you want proof that you reported this. Because then, right now, like years ago, we didn't have social media at the extent that it is now. But now we, the patients, have a tool that we can use. There's quite a few tools on social media that we can use, whether we're putting it on Facebook, whether we're talking about it on YouTube, whether we're doing it on LinkedIn, whether we're going on TikTok and doing it, putting the information on TikTok. We have places now where we can report it. And guess what? Patients have a power. Patients, you are empowered. You have that powering tool. And I'm not suggesting for 1 minute that you make it up or that it's really not gaslighting, but you think it's gaslighting. There's ways that you can actually check to ensure that it's gaslighting. One of those ways is you can actually reach out to me. You can actually reach out to the group, The Patient's Voice by Chums. We have a Facebook group. You can send a comment and say, hey, this happened to me when I was at Dr. Z's office. Is this something that should have happened? Is this really gaslighting? What, am I imagining things? Because a lot of times you're not imagining things. A lot of times those prejudice and bias that rule when it comes down to your patient, when it comes down to patient gaslighting and medical gaslighting, is really happening. It's not all in your head. And if we don't start talking up and we don't start speaking up and speaking out and asking questions when it occurs, guess what? Once again, it's going to keep happening. So one of the missions of CHOMS MediHelps Foundation is to make sure all patients are educated. Medical gaslighting is a real thing. It's so real that it's the word of 2022. Medical gaslighting is the word gaslighting is because it happens across industries. But when it comes to medical gaslighting, that's what I'm interested in. When it comes to medical gaslighting, that's what I want patients to be educated on. So gaslighting is a word and it happens. But you know what? If we don't say nothing and we keep allowing it to happen to us, to our loved ones, to our community, to our patient community, it's gonna keep happening. We're gonna keep struggling. We're gonna keep on that same path. And so it's time now, especially at the end of 2022, when we've been getting ready to walk into 2023, for us to put an end to it. Stop the discriminatory practices that patients are receiving. Stop the, foolishness and the nonsense that's involved with gaslighting. Let's put an end to it. Let's bring it to the point where all patients, especially those patients that I work so closely with, the underserved and the marginalized communities, let's make sure that we all use our very important tool, which is our voice, to make sure that those things that are happening that shouldn't be happening are brought to the forefront. So as I close this video for today. I want to thank those of you who watched. I want to thank those of you who, continue to watch and continue to support me as I go about making sure that all patients realize that there's an important thing that they have is called their voice, and making sure that they feel comfortable using it, speaking up, speaking loud, and speaking often. And once again, as I say all the time, speaking loud does not mean going in and being boisterous and being having a nasty attitude and just doing the most. That's not what it means. It means speaking above a whisper, where what you want and what you need when it comes to your treatment and the protection of your health are the things that you are given. Until next time, this is Sandra L. Please reach out to me if you have a question, if there's a topic that you want to be discussed, and maybe there's a guest that you like, Sandra. Why don't you ask such and such to be on? She could add some power, or not even so much power, because I'm not looking for power. I'm looking for protection of the patient. So maybe there's something that they can share. In 2023, I will be rolling out where I will be inviting guests to come on to share their thoughts on what we as patients could do. Because I don't know it all. I don't say I know it all. I know a lot, but I don't know it all. I know there's things that we should be discussing as patients that are not being discussed, that we have no idea about. So, beginning in 2023, I will be having guests that come on to speak to those things that are important to patients that we should know about. But until next week, I want you to continue doing all you can to protect your health. Have a rest of an awesome, awesome day.